Dear students, I, Miss Madhuri Shinde, welcome you all. Today, in this video, we are going to discuss about therapeutic drug monitoring. Therapeutic drug monitoring is a process in clinical pharmacology which specializes in measuring the concentration of certain drugs in body fluids and clinically interpreting it to obtain useful and often life-saving information. Some drug produce satisfactory therapeutic activity in some person, causes toxicity in others, and has little effect in some. Hence, to improve the situation, clinical pharmacokinetics and laboratory technology were integrated with the clinical medicine, giving birth to therapeutic drug monitoring. And its main aim is to maximize the benefit of a prescribed drug, simultaneously minimizing its toxicity. With the therapeutic drug monitoring, patients benefit medically and economically. Therapeutic drug monitoring is done only for a few selected drugs with a narrow therapeutic range, where the challenge is to avoid both subtherapeutic and overtly toxic dose. Next, we will see factors to be considered during therapeutic drug monitoring. Several steps are required in systematic process of drug monitoring, and the steps are as follows. So the very first step is collection of patient data. To monitor therapy effectively, one must have an adequate database of patient information. The database is central to the monitoring process and consists of factors such as demographic data about patient, chief complaints, past medical and drug history, history of present illness, physical examination, social history, and laboratory data. Second factor which considered during therapeutic drug monitoring is statement of therapeutic goal. The pharmacist must familiarize himself with the therapeutic goal that have been set for a patient in association with the physician. This knowledge is necessary for the pharmacist to access the therapy and determine the clinical importance of a problem that are identified. Problem oriented medical record system are also beneficial for setting the therapeutic goal. In this system, each patient problem is approached by supplying subjective and objective information concerning it as well as assessment of the problem and plan of action. When the goal of therapy have been well established and defined, then orderly progress of the monitoring process can proceed. Next parameter is selection of drug therapy. A pharmacist can make his knowledge of a drugs available to the prescriber to ensure that patient service the most appropriate drug or dosage form. This can be done either before a drug is selected or after a drug has been prescribed. The pharmacist should be available to the physician to discuss therapeutic alternatives before a drug is selected and prescribed. The selection of a drug to achieve a therapeutic goal is a logical process in which patient's condition is matched to drug characteristics. The characteristics of each drug should be considered regarding side effects, method of administration, cost of potential drug interactions with concurrent therapy, disease states, and diet. Next parameter is establishment of monitoring parameter. Pharmacist should establish monitoring parameters to assess the progress towards the therapeutic endpoint. A monitoring plan should outline parameters that will be useful in determining whether the therapy is effective and whether the drug is producing any side effect. A monitoring plan usually consists of combination of subjective and objective parameters. Subjective parameters include factors which are measurable by laboratory tests, vital signs, X-ray reports, and blood level of drugs such as digoxin level, pulse rate, heart size, and ankle edema. Subjective parameters includes factors which are not measurable and require a value judgment such as general appearance or the patient own assessment of his progress. Like patient would be increased exercise, tolerance and nausea. Pharmacist should monitor these parameters daily and also review the progress notes of the physician and nurses. Pharmacists should maintain communication with physician, nurses, and patient to increase the effectiveness of the monitoring process. Moving to the next, identification and confirmation of problems. A key function in the drug monitoring process is the pharmacist identification of existing or potential problems resulting from drug therapy. Pharmacists should use all the information sources for the identification and confirmation of problems, and pharmacists should screen and separate patient problems into those which could benefit from drug therapy and those which may be induced by drugs. When a problem is thought to be related to the drug, then research must be conducted concerning the disease state, laboratory data, drug doses, and other drugs to document the relationship. And the last parameter is communication of findings. When a problem related to the drug therapy has been identified, the pharmacist must communicate with the appropriate health professional to initiate action. For a problem involving drug administration, a nurse may be the professional who can best solve the problem. If problem involve patient intolerance to the drug, the pharmacist should consult with the physician to suggest an alternate drug or dosage formulation. Pharmacist should communicate the finding in clinical communication form. This form should be prepared in the duplicate in which one copy is sent to the appropriate health professional and the duplicate is kept by the pharmacist to document his activities. Thank you.